Everyone. Today we are so fortunate to have with us Dr. Cara Loubser. She's a resident dentist at Optismile, and we're just going to hand over straight to you to give us a bit of an introduction. Welcome.
Thank you for having me. It's lovely to chat to you today. I'm a general dentist and associate dentist at Optismile. I practice broadly, so I don't focus only on one thing, but I am passionate about patient care and patient training or information sharing. I feel that patients should learn from us, so that is what hopefully we'll be doing today. But I do across the board all the treatments that most general dentists do.
Perfect. So what led you to become an expert in dentistry and oral hygiene wellness practices, and what drives you to keep going in this domain?
I've always been very passionate about my patients and their well-being and caring for them, and I feel that the more my patients understand their own health and their own oral health, the more they can take ownership of looking after it. So the more tools I have in my toolkit, the more I can share with my patients and empower them to look after their own health, and the more I can offer my patients in the way of treatments and modern things, technologies, materials. So I've always kept learning. I've always been passionate about learning, and the more I learn, the more my patients benefit from it and the more I can share with them.
That's amazing. Okay, so what are your thoughts on female wellness overall and the level of female care in South Africa?
I do feel that overall female wellness is becoming more of a thing. Everybody is becoming more aware that it is something separate from just general wellness.
Yes.
And it's great to see that there are people speaking about it online and on apps. And there is this femtech movement where people are creating things specifically for women, which is really great because we have somewhere to go if we want information specifically on female health. In South Africa, however, with the politics and the financial situation in the country as it is, and people withdrawing funding for research and things like that in our country, it is still very much underfunded and undersupported in specifically the government sector or the public sector. In the private sector, we are seeing a lot of development and things coming in that are supporting women's health and bringing awareness to women's health, but in the public sector that is still very much lacking, especially funding for it. In the rural communities, there's still very much the stigma sometimes attached and a lack of information given to women in rural. So they don't always have access to the information because the internet's not readily available. So even though there is development globally, it is not always accessible to everybody. Legally, women's health is something that we are entitled to, but often I've experienced it myself in public sectors where they are being charged for services which actually they should be getting for free, and it's not available at every clinic and it's not given at every clinic, so it's unfortunately still not accessible to everybody, although there is growth globally and there's more awareness globally. Women's health is actually very important, and there's a lot around women's health that we need to learn about and incorporate into general health practices.
Exactly, I agree with you. Okay, let's chat about the importance of oral hygiene. Why is it important to care for one's teeth? It would seem pretty obvious. How does it contribute to the rest of a woman's health?
So your oral health is actually a lot more closely linked to your general health than most people are aware of. And it goes in both directions. Your oral health affects your general health, and your general health definitely impacts your oral health. So both systems need to be healthy, and they are linked. Unfortunately, your mouth is not just separate from the rest of your body, and everything that happens in your mouth will have a knock-on effect in the rest of your body. I'm sure everybody's heard about the bio gut that everybody's so focused on supporting at the moment. Everybody wants to heal their gut and support their gut biome, but they forget that your oral biome is directly linked to your gut biome. So if your bacteria in your mouth you're not supporting the correct ones, then you're going to have overgrowth of the negative bacteria, which can promote inflammation, promote disease, and that'll have a direct link to your gut biome, but also upregulate inflammation in the rest of your body. There's a lot of research that is still ongoing and in progress at the moment about things like mental health issues that are linked to oral health issues. and that your system, because of all the linked nerves and lymphatics and blood vessels, what goes on in your mouth has direct access to other parts of your body, and things like dementia and Alzheimer's. They have found bacteria from your mouth triggering things in the brain, and it's closely associated. Although they haven't found direct causes for things yet, it is ongoing research, and they are finding that it is actually linked to things in your mouth. So just having a healthy mouth can directly impact things like your heart and your brain in the long term over many years. And then besides that, just being functional and using your mouth for what it was designed for nutrition. If your mouth isn't healthy, you are not going to be able to speak nicely, you won't be able to eat nicely, you won't get the right nutrition in because you can't eat the things you need to eat because you're either in pain or you don't have the teeth because you've lost teeth. So having an overall healthy mouth is going to affect how you function in that regard as well. So having a healthy mouth means that you can focus on eating the right things.
Absolutely. I was going to bring up the dementia research because it's been so fascinating to see the link. I mean, for years and years, we were thinking completely something else, and now it's amazing how it's tied. Perfect. So let's unpack 3 good practices that you would recommend for your teeth, for your mouth.
Well, the first thing really is just to go for your regular checkups and your cleaning. You should be seeing your dentist or your oral hygienist at least once a year. Prevention is always better than cure. If we find things in the early development of disease, we can still treat it, sometimes reverse it, and prevent it from becoming a much bigger issue later down the line. I always tell my patients, dentistry is not expensive, neglect is expensive. If you leave something for 10 years, at some point it probably is going to become a big problem, and then it's going to take long to fix, and it is going to be expensive to fix. Whereas if you go for regular checkups and you do your maintenance, it is not going to be difficult to do that. So going for regular cleanings, getting into places where you maybe struggle to reach at home, you are possibly going to build some tartar somewhere. So keeping a tab on what's going on in your mouth on a regular basis is a good way to get ahead of problems. That doesn't become a massive issue later down the line. So that's the one main thing. And then ask your dentist questions. Most dentists really care about patient empowerment, and we want you to know what's going on because then you can look after it. But we don't always know what you don't know. So the best way for us is to have an open line of communication and just ask me anything, ask questions when you're at the dentist. What are we doing? How do I look after this when we are done with it? What can I eat? What can't I eat? How do I clean this? How long is it going to last? When do I need to have it repaired or checked into again? So then you also know how to look after your own mouth. So just knowing is really important. So chat to your dentist. We generally do want to share with you. And then getting the basics right is really important. And when it comes down to it, the best way to look after your mouth is just brush and floss. It's really that simple, and people tend to sometimes overcomplicate things like that. You just need a simple toothbrush and some floss, and there are so many videos online and apps that you can use. A lot of the toothbrushes these days come with apps that tell you how to brush and when you are going wrong. But you don't even need something that fancy. Honestly, just having a good basic toothbrush is all you need. Physically removing the film of bacteria from your tooth surface is what is going to prevent disease. And you don't need fancy toothpastes or fancy toothbrushes that sing and talk to you all the time, and you don't need any specific floss. Just brushing twice a day and flossing once a day is going to prevent a lot of the issues that most people have. A lot of people tend to focus on genetics, and they think that they have really horrible teeth just genetically, but I actually find that that's inhibiting them because they think that they have no control of health, when really 90% of the issues you see is stuff that can be prevented if you just brush and floss correctly. So I recommend taking your toothbrush with when you go to see your oral hygienist or your dentist, and ask them, how do I use this toothbrush? This is what I have, this is the floss I have, show me how to use this. And I'll happily do that because everybody is different. Some places are more difficult to reach. So if you take what you have with you, it's easier for me to show you how to get into the difficult to reach places.
You're so right. I think the key is consistency as well, because it doesn't help if you over brushing and then nothing for like 2 days. Yeah.
Consistency and building a good habit is really important. I often tell my patients to sort of do habit stacking, where you link your habits that are not easy for you to remember or that you don't enjoy to things that you know you are going to do every day. And I often tell my patients, because flossing is the bane of everybody's existence. No one likes to floss. I don't enjoy flossing. No one's looking forward to that at the end of the day. So reminding yourself to do it is the best way to do it. So my patients to leave floss where you see it. Yes. So that you at least floss once a day. So if you read emails at 11 o'clock in the morning, leave your floss at your computer so that when you see it, you remember.
Exactly. But you were so right as well about the genetic factor, because I think overall, our genetics only count for like 10 or 15% of the outcome. The rest is due to lifestyle.
Yes, exactly, 100%. And all your genetics can be upregulated and downregulated depending on what you are doing. And so you can support, for example, salivary flow rates, and what is in your saliva is dependent on how much water you drink, what you are eating. What you're putting into your body is what's going to come out. So if you are not eating the right things, you're not going to have the right things coming out. If you're not brushing correctly, you are not going to have good teeth, even if you have the best genetics under the sun. Exactly. Yes, some people do have slightly thicker enamel, but they still have to clean that enamel. So at the end of the day, it really comes down to removing the bacteria off of your tooth and preventing bacteria from overgrowing. So controlling nutrition and controlling oral hygiene is the best way to do that.
Perfect. Okay. In your expert opinion, where do you feel we are going wrong besides the flossing? What are you finding with your patients that perhaps we could focus on doing better?
I think people overcomplicate their oral hygiene. There's a lot of trend following, especially getting information on watching fads on TikTok. And I'll have patients who are trying out 7 different toothpastes, and the one is a powder, and the one is charcoal, and the other one has hydroxyapatite, and they're focusing on the toothpaste and the mouthwashes, and they found a gadget that's brushing their teeth for them. But a lot of that stuff can actually be more damaging than what it's helping. Getting the wrong information is also an issue because people are focusing on the wrong thing. For example, the ingredients in your toothpaste. You can technically clean your teeth without toothpaste. You don't need toothpaste to have clean teeth. The brushing is the main thing that is going to clean your teeth, not the toothpaste and not the mouthwashes. And there's a lot of fear-mongering around certain ingredients like fluoride, and people tend to focus so heavily on that one specific ingredient, or they want specifically hydroxyapatite, but it's not going to do anything if you have this fancy toothpaste but you're not brushing correctly or you're not flossing. So at the end of the day, it comes back to the basics. It's just getting the basics right is going to set you up for maintaining what you have in your mouth and preventing disease and promoting things like healing, healing the gums, healing the minerals in the saliva, and fixing your enamel by having good mineral content in your mouth. Ask your dentist for the input. They will tell you what can and cannot work in your mouth, because there's no one size fits all toothbrush, one size fits all toothpaste.
Yes.
For every patient, it will be customized depending on your specific needs. So I think that following the trends on TikTok rather than getting advice from their dentist or hygienists about specifically what they need, and that is where patients often go, as they're focusing on the wrong things. And if we fix the basics, often when I see my patients 6 months later down the line, we don't have those same issues anymore.
Perfect. I just wanted to quickly go back and talk about mouthwash, because there's been a lot of information coming out on that. What is your opinion on mouthwash?
So most people do not need a mouthwash. Both toothpaste and mouthwash are there to pretty much add things into the oral environment that supports the mineral content or remineralization, or to lower the bacterial load in your mouth. But you cannot clean your teeth with a mouthwash. Mouthwash can only work on a clean dental surface, so it can only stick to your tooth when there is no biofilm on it, and it can only penetrate into your enamel when there is no biofilm on it. You can only remove biofilm by brushing. So you can't use a mouthwash in lieu of brushing. You still have to brush. So rinsing your mouth is not going to remove the plaque. It's going to give you fresh breath, but that's pretty much the extent of what that mouthwash is going to do. There is no mouthwash that physically takes the bacteria off of your teeth. Where mouthwash plays a really big role is if you have very low salivary production, and when you sleep, most people's salivary production really goes down quite a lot. And especially if you're a mouth breather, your mouth is going to be super dry at night. And often that is when the bacteria starts to take over. And then if you do have any sugar anywhere in your mouth still left over, they're going to start making acid. When you wake up, you're going to have super bad breath, and you're going to have development of cavities and things like that while you sleep. So to prevent that process from happening rapidly, that's where mouthwashes come in. So if you've brushed your teeth really well and it's nice and clean, and then you rinse, some of the minerals and the enzymes and things like that in there will stick to the surfaces, both the gum and the tooth, and it slows down the repopulation of the tooth and gum with bacteria. So there's going to be less bacterial growth and less enzymes and bacterial byproducts being formed while you sleep. But it's a limited time only. It's going to work for about 4 to 6 hours, and then the bacteria will just be back to normal. So you still need to clean your tooth surface, and this just basically slows down the process of the bacteria coming back. So it's mostly effective during night. In the daytime, if you rinse, you're pretty much just going to be getting fresh breath from a mouthwash, but it does not do the cleaning. In some cases, I will prescribe medicated mouthwashes, but that is only if you have a specific condition like gingivitis that you are seriously struggling with, and we're trying to help you to get rid of some of the aggressive bacteria or slow down the growth of the aggressive bacteria so that you can keep it clean consistently. So most of the time, if I prescribe medicated mouthwash, you're only going to use it for 14 days. You do not need medicated mouthwash on a regular basis, because the bacteria in your mouth will also at some point develop mechanisms to counteract medicated mouthwashes. So it's sort of like antibiotics. If you use it, at some point it's no longer as effective as we need it to be. And then when you do have the condition that we need to treat, that mouthwash is not going to do what it needs to do. It won't help you. And often those mouthwashes are also very staining. So if you use them long term, your teeth become brown over time. So medicated mouthwashes should really be used when you need it. And if you are keeping your teeth clean with a toothbrush and flossing, you most of the time do not need a mouthwash.
Okay, great. We've seen a lot of amazing tech advances in the media recently. Can we chat about this a bit?
Yeah, sure. So what's great about dentistry, for me at least, is the constant development of materials and equipment and technology, and that is why it is so great to be a dentist in modern times, because almost every week there's something new that's research has shown and that they've developed and it's coming out. It's very handy mostly in a dental practice. Some of the tech that is coming out again on like TikTok for patients specifically, that's more market driven and it's not really so much for dental health care. The stuff that we get to work with is where it's really amazing, because everything that is developed and comes out now makes my job easier when it comes to diagnostics and doing the work, but it also makes things safer for patients and less invasive and less painful and faster, and everything is lasting a lot longer because of the development in tech, and we can diagnose a lot more things, we get to see a lot more things because there is all this technology coming out which gives me access to more things. I have records that we can keep online or keep as a digital format, so I can share it with people. If I'm speaking to a specialist, I can just share these digital records and things that we have found with them. It's a lot easier to communicate with my patients because they can see what I see, and I can show them inside the teeth and show them inside their mouths. And when we're doing planning for treatment, because we have digital designs and things like that, I can also show the patient what the outcome could be so that they can visualize it before we even start their treatment, because your mouth is very personal and the outcome is going to be quite important to you. So that's a great communication tool and a great way for patients to understand what I'm doing and why I'm doing it.
Right, that makes a lot of sense. Okay, next question is unrelated. How is good nutrition tied into having good teeth? Maybe we can chat about this also with relevance to being pregnant.
So most people have heard that food is medicine, that saying, and it really is very true. And it also holds for the health of your oral environment. What you eat, the first place things into your body is in your mouth, and there's bacteria on it, sometimes viruses. But what you eat is also going to relate to what comes out in your mouth. Again, with saliva, for example, you need to take minerals for your saliva to have minerals in it as well. And the biggest role that I think nutrition plays in your oral health is based on the types of foods we eat these days. The thing that is the most destructive in your mouth really is sugar. So the bacteria in your mouth, the good bacteria, lives off of things like fiber and protein and fat. Whereas the guys that are destructive, the bacteria that's doing the damage in the mouth, is going to rely heavily on sugars and fermentable carbohydrates. So whichever way your diet is leaning, that is what's going to happen. If you tend to eat a lot of sugary or acidic foods, you are going to increase the acid load in your mouth on a daily basis. Or if you snack on acids and sugars the whole day, your oral pH is going to consistently be acidic. And the acid is a problem because your tooth structure is made of minerals which dissolve in acid. So the more sugar you feed the bacteria, acid they produce, and the more they are essentially eating or dissolving your enamel, and that is how cavities form. Your saliva acts as a natural buffering agent in your mouth, and the more minerals it contains, the more it's going to buffer the acid in your mouth, and the more it's going to remineralize areas in the enamel dissolved by the acid. So if you have a lot of saliva and you have a lot of minerals in your saliva, you are somewhat protected against this acid load, but it takes time for the saliva to buffer the acid. So if you've had a snack, and then an hour later you have another snack, and then 2 hours later another snack, and all of those are sugary or acidic, you bring down the pH every time, and your body sometimes struggles to bring up that pH again. So for all the hours that you have acid in your mouth, you are consistently losing minerals, and sometimes there is not enough in your saliva to repair. So the more often you're eating sugar and acidic foods, the more often you are damaging your enamel. So often it's really important to try and limit how many times during the day you are consuming sugar, because if you eat sugar once a day, then the rest of the day, the minerals in your saliva are repairing the enamel and neutralizing the acid load in your mouth. The other thing with sugar and fermentable carbohydrates is going to promote the growth of the negative bacteria. And the more of those you have, the more destruction there's going to be to both the gums and the enamel. So eating fibrous foods and whole foods and less ultra-processed things is going to promote the growth of the good bacteria that supports the health and lowers the inflammation in your mouth. Whereas eating a lot of sugary things and things that stick to the surface of your tooth, so the more sticky it is, like sweets and things that you constantly suck on, for example, lozenge type of sweets, that's extending the amount of time that there's sugar in your mouth, which extends the amount of time that the bacteria is going to be producing acids. Snacking less frequently and snacking less on sugary things is really important. Eating healthy fibrous things and healthy proteins and fats is going to promote the right bacterial growth. And then with food for during pregnancy, for example, what you're eating is directly going to affect your immune system, and your inflammation is going to be translated to your baby, but also what you are consuming is what's going to help with the growth of your baby. All the cells in the baby's body are dependent on what you are consuming, because that is where they are getting their nutrition. So if you are not eating the correct balanced diet, your baby's not getting enough protein or not getting enough minerals, that's going to affect their tooth development as well. So I have seen moms, for example, who have the condition where they eat very strange things when they are pregnant, and I've had a mom who ate toothpaste and unfortunately overloaded her with fluoride, which directly overloaded the baby with fluoride. So what you is going to affect the development of your baby's teeth. As you are eating healthy food, the baby should develop well, at least their teeth should develop well. So when the first set of teeth come out, they will be nice and strong and resistant to their own oral biome. So it is important when you're pregnant to eat a well-balanced diet and to maintain your oral health as well.
I'm going to ask a very stupid question, but you've been speaking about minerals in your saliva.
Yes.
Is there a way of cheating and getting these minerals added to your saliva?
Well, that is one role that some toothpastes do have.
Okay.
So toothpaste is one of the vehicles for minerals.
Yeah.
So a lot of the modern toothpaste will say rebuilding or repairing or remineralizing, and they will have a very high load of minerals in them. But producing more saliva sometimes will increase the mineral load. Just balancing your diet, making sure you're getting good food is going to increase the mineral load in your saliva. And then using a good toothpaste, but you don't have to buy something fancy. I know hydroxyapatite is very high on people's fad list at the moment. Everybody's trying hydroxyapatite. But a lot of the minerals that make up hydroxyapatite are already in toothpastes. So if you use a mineral-based toothpaste that says it's rebuilding or repairing, it'll have a lot of those minerals in, and they will be floating around in your mouth after you've used your toothpaste. The ones with fluoride in, a lot of those minerals are charged, and they will actually stick to your tooth surface and hang around for the whole day. So as you are losing minerals, there is a reservoir of minerals in your mouth that will immediately start the repairing and the rebuilding.
Yes.
Use a good toothpaste with minerals in. It should help repair any of those issues that you have during the day when you're eating acid. But there's still some diets that are so overloaded with acids that it's too much. You cannot counteract it with just brushing twice a day with a mineral toothpaste.
Okay, great. So I can imagine that having good oral hygiene definitely impacts on mental wellness and health. In fact, I can see how they'd influence each other. What is your opinion on that?
Yes, there is very much a link between mental health and your oral hygiene, and it also again goes both ways. Your mental health can affect your oral hygiene, your oral hygiene can affect your mental health. There is a strong link between the two. Smiles are very integral to how we communicate with the world, and if you are not confident in how your smile looks, or you feel that your breath smells, or you don't have nice teeth, or you might think there's a cavity, people can see it, the way you communicate with the world is going to be affected, and the way you feel about yourself is going to be affected. So it is a very personal thing. Some people are very sensitive about their smiles and health and how people perceive them based on their smiles and their oral health. And in that way, it can affect your mental health negatively if you are not healthy, and if your breath doesn't smell nice, or you don't want to go out because you don't want people to see your teeth. And there are perceptions around, for example, alignment. Some people feel that if your teeth aren't straight, you aren't smart, or you're not well educated, or you come from a less privileged background, and that affects people's mental health as well. So how you appear to people smile-wise has a big effect on your mental health. But also things like inflammation in your mouth and bacteria in your mouth have been linked to affecting hormones and inflammation in the brain, and that can also be related directly to mental health issues, and that is an ongoing area of research as well. Sometimes really good oral hygiene can affect hormonal balances in the brain, and that can also affect mental health. And then the inverse is that if you have negative issues with your mental health, you're struggling with your mental health, the last thing probably on your to-do list is to focus on oral health, and that often gets left behind then. So patients sometimes struggle to maintain good oral health when they have mental health issues. So making sure that your mental health is something on your priority list is important, because it'll have a knock-on effect on the rest of your health if you don't take care of your mental health. So both do affect one another, and there's a lot of medications actually that patients take for mental health issues that have effect on your oral health, which people are not often aware of. So it's really important when you see your dentist to just let them know what medications you are on, and if you are struggling with mental health issues, because it will have an effect on your mouth, it will have an effect on how we treat you and things that we can and cannot do for you. And there are sometimes easy things to change with regards to medications. We can swap it out for something else, or speak to your mental health provider to make small changes that will have a big impact on your oral health and the way you can look after your mouth. So they are actually very closely linked.
Wow. I didn't know that about the medication.
Yeah, there are some medications that stimulate things like grinding, for example, and I have patients that have come in with constant headaches and pain that they associate with other things. Meanwhile, they were just switched to a new medication that has now caused them to start grinding their teeth a lot more, and they've noticed their teeth are getting shorter and shorter, and they're constantly in pain. And sometimes all we need to do is just change the medication they're on, and that will affect things like grinding and headaches.
Wow. Okay. Let's chat about preventative and protective techniques, practices, and methods. What do you live by?
So, back to the basics. Prevention better than cure. So, just keeping your mouth really clean on a daily basis is the best thing you can do for yourself when it comes to looking after your teeth. So, going for regular cleanings, going for dental checkups, making sure you get ahead of problems so that they don't become bigger problems. Definitely getting a good toothbrush. The chat about toothbrushes just now, I often recommend electric toothbrushes to my patients, and it's not because it's fancier, but at the end of the day, I think I see 3 patients a year who actually manage to do the correct brushing technique with a manual toothbrush. The manual toothbrushes can definitely clean your teeth 100%, but you have to do the right technique, and most patients struggle with the correct brushing techniques. And when you're tired at night, very few people are going to spend the amount of time you need to spend with a manual brush to do the cleaning correctly. Whereas with electric brushes, if you get a good brush that is doing about 40,000 movements a minute, is doing all the cleaning for you, and all you have to do is put it in your mouth and move it across each tooth, and it's doing everything for you. There's not a serious technique issue involved, and you can almost sleep and brush your teeth and it'll still be cleaner than if you try to do that with a manual brush.
Yeah.
Most of my patients are using electric brushes these days, and I can see the difference from when they came in and they were using manual brush and struggled with the technique to switching over to an electric where there's not so much technique involved. I can see when I see them 6 months later that things have improved remarkably. So things like electric toothbrushes really make a big difference in that regard.
Yeah.
Fluoride, the one that people tend to avoid. There's a lot of fear-mongering online around fluoride, and it's really earned a bad reputation unfairly. There's a lot of research. They've studied fluoride in oral health, for example, for more than 70 years. And the safety profile is really good if you just stick to normal fluoride toothpaste.
Yes.
I mean, you get fluoride in food, you get fluoride in water. And just to give an example, the amount of fluoride that you get from your toothpaste will range between 0.1 and 0.5 milligrams per milliliter. So that is very normal, because the upper limit for babies or infants, for example, is 0.6. So even if a baby were to use adult toothpaste, and you are still not going to cross the limit of what is safe. And in South Africa, we are no longer fluoridating water. We haven't fluoridated the water since, I think, 2006. So you are not getting fluoride from the water most of the time, unless you are using groundwater or borehole water, in which case check your water to see what your fluoride levels are. But for most people, using a pea-sized amount of fluoride toothpaste, the benefits very much outweigh the possible negative side effects, and the negative side effects are almost negligible, because you're getting equal amounts of fluoride in food and water as you do a pea-sized amount of that toothpaste. So the only time it's a problem is when you have children who are eating their toothpaste. We don't want you to ingest the fluoride. We want it to be applied on the surface of your tooth, because that's where it's going to strengthen your tooth, and that's where it's going to help to remineralize your teeth. Hydroxyapatite is a new kid on the block. They have been doing a lot of research on hydroxyapatite. Hydroxyapatite is basically the crystal structure that your enamel is made of naturally, and it contains phosphate and calcium ions. The difference between fluoride and hydroxyapatite is that fluoride binds to your tooth a lot readily, binds a lot easier to your tooth than hydroxyapatite does, even when it's free floating around your mouth, because it's charged. So the fluoride molecules will go and stick to the surface of your tooth and stay there, and when there's acid, they immediately get incorporated into the tooth structure as the remineralization process is happening. It does also happen with hydroxyapatite. It's just a little bit slower and a little bit less effective than fluoride. And once fluoride has bound to your enamel, it becomes fluoroapatite, which is very resistant to acid, much more so than hydroxyapatite. And that is where the benefit of fluoride has been shown. Over hundreds of studies that have been done, they've shown that if you've used a fluoride toothpaste, your teeth are more resistant to acid attack from bacteria than they are without. That's why there's a massive jump in the generations. Before fluoride toothpaste, everybody had hundreds of cavities and lots of fillings. And the moment they introduced fluoride toothpaste onto the market, there was a marked decrease in oral health, caries, disease, things like that, because of the fluoride. The fluoride protects you against acid, but it also protects you against the negative bacteria. A lot of the oral bacteria that creates cavities and oral disease doesn't like fluoride, so they don't multiply in the presence of fluoride. So you're lowering the bacterial load. So there's less guys producing acid, and your tooth is more resistant to the acid when you have a fluoride toothpaste. So as long as you don't eat it, and you are using a pea-sized amount, very, very small amount of fluoride that you're getting into your mouth is so small that it's not going to harm you.
Yeah.
And if you're really worried, just rinse your mouth out afterwards, because then all the extra fluoride comes out, and the ones that are charged are going to stick to the tooth surface, which is where we want it to be anyway, and it's still going to have that effect that we need it to have. So using a good fluoride toothpaste, I still recommend that to my patients. If you are really terrified of fluoride, then hydroxyapatite is a good thing to use as well. Lots of minerals that will help with the remineralization process, but I still recommend fluoride toothpaste for my patients as a great way to be proactive about protecting your enamel.
Yeah.
And keeping it up there.
Perfect. What are, on the other spectrum now, what are 3 horrendous tooth health habits that you wish people knew were detrimental to tooth health, besides sort of eating sweets and that?
Okay, so there's a big trend for doing lemon water shots and vinegar shots. And those things are really acidic. And I often see patients who are doing that on a regular basis. They are rapidly losing enamel because
Why do they do that?
A lot of people believe that it's really supportive for your immune system. It regulates your acid and alkaline balance. There's not really scientific evidence supporting this at all. It is more of an online trend and a fad at the moment to do that. The health benefits are not really clinically shown, but it definitely damages your enamel. Some people have completely removed the surface layer of their teeth. Now they have opened the inside structure of their tooth, which is very sensitive to bacteria and it's very soft. Once the cover of your tooth enamel is gone, the dentine doesn't have resistance to acid and it just rapidly gets eroded away and your teeth become shorter and hollowed out. Avoid doing lemon water and vinegar shots on a regular basis, and if you really want to do that, at least drink water afterwards to try and neutralize that acid. And do not brush your teeth immediately after you've had acidic things. So if you've had lemon water first thing in the morning, don't go brush your teeth immediately afterwards because your enamel is soft now. And if you go brush it, you remove your enamel. And it's actually the same thing with coffee. Coffee is actually quite acidic. So if you had 2 or 3 cups of coffee and then you go brush your teeth, that coffee has softened your enamel a little bit. Then the brushing, a lot of people think that they should use a really hard toothbrush. And the harder you brush, the better it is for you. You're going to get all the bacteria.
I was one of those people. I used to be.
Yeah, I'm glad that you've seen the errors in your ways, but the hard brushes are actually very damaging. They damage the gums and they damage your enamel. You do not need something hard to remove the bacteria off your teeth. The plaque is actually quite soft. You could wipe it off with a tissue or with your finger actually. So using a gentle brush is the best way to protect your enamel, but also to protect your gums. So the main area that you're going to find bacteria is it's going to grow along your gum. You need to brush your gum line. And if you go into the gums with a hard brush, gums are going to get irritated and they will move out the way, and then you are going to open up the root surfaces, which are very sensitive. So try to stick to soft brushes, don't use a hard brush. And one of my pet peeves is people using their teeth for things that are not food. Opening packets with your teeth and chewing things like ice or pieces of plastic with your teeth, they're not designed to do that. Those are really, really hard and they can crack your teeth and they can crack the enamel, break pieces of your teeth off or wear them down over time, and that can cause cavities. That can cause pieces of your tooth to completely break off, and then you need a crown, an inlay or something like that to repair your teeth. So be gentle on your teeth. Don't use them for things that are not food. Try not to bite into hard things with your front teeth especially. Because that's going to crack them and cause issues in the long run.
One would think that was common sense, but obviously not. Yeah. Okay, so what are your top 3 treatments that Optismile offers that you feel that you guys are really brilliant at? I know the Invisalign is one.
Yes, so we do what we call ABCs, which is to align, to bleach, and to bond with composite onto teeth. So we try to do as little destructive work as possible, and putting your teeth in the right place is going to save us on space. We don't have to cut things down to make space. So aligning your teeth is not only aesthetic, it can be functional as well. Some people really struggle with cleaning their teeth just because of the position of their teeth, and putting your teeth in a straight line is going to make it a lot easier for you to get into difficult to reach places.
Yes.
But also it creates space for your tongue, and sometimes it affects the way your joint is functioning as well. Some people who have immense joint issues, if we do alignment, we can sometimes alleviate some of your joint issues. And a lot of the aesthetic concerns that patients have is often to do with the way their teeth are sitting over each other or overlapping. Yes, you could do destructive treatments like crown and bridge work to try and correct that, but if you just put your own teeth in the right place, then you are no longer damaging your teeth and you are saving them in the long run. You're not going to wear them down if they're in the wrong place, and you can function nicely as well. And then we do bleaching to lighten teeth as well. You could do bonding to lighten teeth or veneers and crowns, but things like veneers and crowns are destructive, so we try to avoid that. We would like to enhance what you already have without damaging what you already have, because the less work we do to your teeth, the longer they are going to last. The moment we remove any part of your tooth, that tooth is now weaker and the lifespan is cut down a little bit of that tooth. So we try to do as little as possible to the enamel as we can. And a lot of the whitening materials that we use these days are loaded with minerals, loaded with water, so we don't dehydrate your teeth anymore, we don't demineralize the surface of your teeth anymore. Some of the studies have actually shown that the surface of your tooth could be harder if you've used a professional whitening gel that is loaded with these minerals. So we do whitening with these types of gels, which are not as destructive as they used to be back in the day, so that when you have lined and bonded or bleached your teeth, they often look so much better that you don't have to do anything else to them. And it's still your own natural tooth. We haven't removed anything. We've put them in a more protected space so that when you use them, they're not going to get damaged. And then if you do have teeth that were worn down because they were sitting at the wrong angle, or they're not quite as big as they should be, shorter, then we can add bonding onto the treatment. So that's something we really like to do. We do smile designs, so we basically digitally create a smile that you would love to have and that suits your facial profile, and then we print those models and we transfer the design straight into your mouth without having to cut your teeth. So we add a layer over your teeth. It's sort of like artificial nails. We're just putting a layer on the outside which tweaks the shape of the teeth and can mildly correct the color of the teeth, and it doesn't damage your teeth. You can replace it once it starts to stain a little bit, or if it chips you can repair it, and it's just like a little varnish on the outside to make your teeth that little bit more perfect. So we really try to do as little invasive procedures as possible. We try to keep what you have and make it as strong as it can be and put it in the best space to maintain it for the long run.
Okay, perfect. Okay, great. And the last question, are there any upcoming events or workshops or collabs or like anything that's coming up, specials, anything you're focusing on?
We do sometimes run specials. All of those things are on our website, so if you do visit our website, you will see if there is a special running. But you are always welcome to chat to us if you want information about things. We do video calls and online chats with patients who want information about specific treatments that we do.
Yes.
So if you are uncertain about certain treatments that you maybe want to have done, but you're not sure if you want to commit to coming in for a full consultation, you can always chat to us on a video call or on our WhatsApp line regarding the types of treatments. We do a lot of consultations, and those are for free, so patients can contact a chat to them, and that's the best way, I think, for patients to get information.
Great. So what are the best contact points? Obviously to phone, website, Instagram, and you told me this morning there's a YouTube channel.
Yes, we have a lot of podcasts that my boss records on a regular basis, and he puts it on YouTube, on our channel there. It's information really to help patients make decisions about their own health care. So it's really giving you all the updates on the newest trends in treatment and things like apnea, which people don't always know they have, and how it's actually linked to your oral health, and nutrition and fluoride and bonding and injection molded bonding versus veneers. All of that information that people are typically looking for are on these podcasts, and that's on our website, and it's also on Instagram. We have a WhatsApp line, or you can go onto our website and you can book directly through the website if you want to book a video call, or you can call. You can email us. We have many lines of communication, but like I said, you can chat to one of our dentists for free on one of the video calls. So if you really want to first get some extra information about things, that's the best place to start.
Great. Thank you so much for all of this. It's been so informative. Thank you for joining us today.
Thanks for having me. It's been lovely to chat to you.